Kuzampo and welcome to our weekly news magazine program Bhutan This Week. I am Sharabdoji. Here are our top stories for the week. People from 19 districts traveled to Phuentsholing this month. Bhutan records its first known case of child contracting COVID-19. And considering people's cooperation and ground analysis of the epidemiological situation, identified shops across Thimphu open. Now let's look at the details. The Prime Minister Dr. Lote Sering says except for Gasa and Lhintse, people from the rest of the districts have travel history to Phuentsholing. According to the Prime Minister, the toll-free number 1023 has received over 1,600 calls from people who have visited Phuentsholing on or after 1st August. But as of 18th August, Gasa district also recorded 12 people who travelled to Phuentsholing this month. Some 900 Thimphu residents have been to Phuentsholing this month. 100 primary contacts of the 25-year-old loader are in Thimphu.
Niankadi zonka kechi gyo nijanga na chapse ise shunibina. Tani beni digi ngachara kahara tusage nami seme ta namya maremegi madimegi tusage chi jenigi ti tulipapchi ise shunibi.
The government will further spend a whopping 600 million yatam to procure additional testing kits for the country.
The majigi manguldi mila mi rere shipche chablo tirutongta jiji dere joyi ise shuni mi rere lurala. Tani the gyakap kalwe masem mashobe droso mafamata midira tama nejitira meba jasu bachin hi sansebe taso bachin mipshule chutu sebenidigi tipingi tugi tsagi anibi jidi kanai shunibi.
After the detection of COVID-19 case from the mini dry port quarantine facility, import and export have been put to a halt at Phuentsholing.
Jego besugi sanumgi gas dime garina lunigi numkona lunigi mahodisume satungi rinam gyakaptina ngachiri dunankyona mappale mebigi pebewachin chumda tamnigi tsaime anizum te sago ngachil lana mathiminale malamidisu malebegobe jana tamni koromme ngachina mimidisu male lengobe tanizum sungachira te khachi meta mimigi disu chamchi ngachigi lenibe ila tanale te sago ngensubdi ma nyusu chi majo chunchu ngachigi nangdin kara atazum mebe esechunibe.
Tests continue across the country to prevent further spread. Sharabdoji, BBS News. Following the Health Ministry's appeal to people with travel history to Phuentsholing on or after August 1st to register through toll-free number 1023, hundreds have come forward and listed themselves. The testing will be initiated for all those registered.
1023. The COVID-19 National Grievance Redressal Help Desk now takes in calls from people with travel history to Phuentsholing. After community transmission in Phuentsholing, the government is taking no chances. Early detection is the only way to prevent the virus spread. The toll-free number 1023 was installed on Thursday to listen to complaints and address them. Nearly 900 calls were made for essential services, health, stranded and others until yesterday. And nearly 500 people who have been to Phuentsholing recently registered for COVID test until this afternoon. And most of them are from Thimphu. A few calls came from Tashikang, Paro and Nganglam. And GNHC officials are taking up this important task to break the chain of transmission. They receive calls from 9 in the morning till 9 in the evening. The number 1023 was used to register for test only since yesterday. People can also register online through the Health Ministry's Facebook page. For now, everybody is hoping that they do not test positive. Samton Dolker, BBS News.
Now, Bhutan recorded its first COVID-19 positive child case from Phuentsholing. The 4-year-old girl is one of the primary contacts of the 25-year-old man who tested positive for the disease in Phuentsholing on 11th August.
According to the Health Ministry, the 4-year-old tested positive in the last 24 hours, although her mother was confirmed with the virus on Thursday. Before this case, a 1.5-year-old baby who arrived in the country along with her mother was suspected to have the virus. However, health officials could not conduct the RT-PCR test since it is difficult to get the nasal swab from an infant. Currently, both the child and her mother are in de-isolation. The Health Ministry's Technical Advisory Group claimed data on COVID-19 infection in children is limited. At present, the disease seems to be much milder in babies and children than in adults. Its occurrence is also less often among children. As per some reports, some children do require hospitalization and intensive care services. In terms of the recovery rate for children, the expert group revealed it is not established yet, although a few reports say it is highest in children than other age groups. However, experts shared the risk of infection is equal for everyone except the severity of the disease will vary. Meanwhile, all 23 positive cases detected since the lockdown are doing fine, with most of them asymptomatic. As of today, Bhutan's total confirmed cases of COVID-19 stands at 133. This is Pasung Doji for BBS News.
In view of the nationwide lockdown, the Health Ministry approved a protocol for availing essential health services during lockdowns. According to the Ministry, the protocol will be applied during all lockdowns, irrespective of the magnitude. And people availing themselves of such services must follow strict preventive measures such as wearing masks, physical distancing, and washing hands frequently.
As per the approved protocol, a health worker or a frontline worker will deliver medicines to people with chronic health conditions such as diabetes, hypertension, tuberculosis, and mental health conditions. At the same time, the Health Ministry advises people with such illness to keep a minimum of 1 month's stock of medicines at all times. The patients can also visit a hospital for consistent reviews and services in private cars or request for transportation facilities and must carry one's prescription or a health book. Similarly, routine immunization for children is encouraged to reduce vulnerability against vaccine-preventable diseases and avail essential health services from identified focal points across the country.
Amso alukini bemi disuda alugi menkap darim lu menkap chamni yula ansu phydochira chimachu seshunibi tenagi nungkorna lakhorna chunruchun rangi gerigi nungkorna chunruchun chimsagi nungkorna chunruchun anika di bave tangamso alukini bedo do chasi suchab do se anikar bajowachin nungkor kachira beru jotha chu seshunibi ta alugi darimgi menkap di beroe tanga ta tichigi dogi menkap renchi kapchaba joyi sebawachin di jotha chu seshunibi la.
Also, to prevent unintended pregnancies and complications related to it, appropriate contraceptives will be available in basic health units and through essential health service focal numbers. Meanwhile, beginning today, the National Referral Hospital in Thimphu arranged teleconsultation services for new health issues. The General Outpatient Department will facilitate the service available from 9 a.m. till 5 p.m. Doctors will make assessment of the patient's condition based on which medical prescriptions will be provided and directed to pharmacy or emergency department. Sangishuso for BBS News.
Now, it looks like people are confused with so many toll-free numbers available for various purposes during the lockdown. The hotline numbers for emergency ambulance services receives all kinds of calls. Health Help Center in Thimphu has been receiving calls asking for essentials, inquiries from stranded people, and also for non-emergency medical advices.
It is around 12 in the afternoon and Health Help Center is flooded with calls. There are 17 agents answering toll-free 112, 2121 and 6060. Yesterday alone, hotline 112 for emergency ambulance services received almost 2,000 calls, while hotline for elderly citizen 6060 received more than 1,300 calls. Toll-free for queries related to COVID-19 2121 received more than 1,200 calls.
Majority of the calls were for medical refills. These 9 agents are answering to calls from people asking for ambulance services from across the country. But some of them are frequently attending to inquiries on stranded people, essentials, and medical refill and facilitating them to the right contacts.
People not using the right hotline for right the purpose. 112 is for emergency services, for ambulance services, like people requiring critical need, life-saving interventions where we need to transfer them to hospitals. So when people call up 112 to ask about all other issues like vegetable services, or trauma services, then people requiring the actually requiring genuine support for the ambulance service do not cannot really call up to 112 because the calls are clocked.
There are also 2 doctors at the center providing health advices and prescribing medication over the phone. The doctors sent prescription copy to pharmacy at National Referral Hospital and medicines are delivered to the patients.
Because of the so many issues coming up with 112 and people complaining about clogging, they are not giving the 112 key number. So we have additionally instituted two doctors per shift so that there are people to respond to their need, for instance, teleconsultation.
Health official says most people who call 112 are not aware that they will have to dial extension on their keypad to avail health services and ambulance service. When you call and when the agent answers, you will have to press 1 for ambulance service and press 2 for other health services. With cameraman Kenchus Ring, this is Sangeet Chizong for BBS News.
As the national COVID-19 situation escalates, the Health Ministry, in accordance with its preparedness plan, will recruit 154 health professionals. This additional manpower will be deployed to regional hospitals and health facilities without doctors.
With just around 3,000 health workers in the country and the COVID-19 situation showing no signs of slowing down, the Health Ministry's human resource is already stretched thin. Moreover, with the looming threat of community transmission in different pockets of the country, the need for additional health professionals is dire. Accordingly, the Health Ministry, with approval from the Royal Civil Service Commission, announced the vacancies on Sunday. As of now, 33 MBBS students studying abroad and who will be graduating this year registered with the ministry.
There are 6 hospitals where there's no doctor at all. So 6 doctors will be sent to these hospitals like Jomotangka, Samdup Choling, Khaling, Chuka, Rangjung and Khamdang. As you know that doctors are shortage as always, so we are sending the remaining doctors to various hospitals, including the 2 regional hospitals.
Similarly, heeding to the call of duty, 20 clinical nurses, 75 staff nurses, 16 lab technicians and 13 radio technicians also came forward for registration.
100 people is recruiting from the recently passed out. If required, we have to pull from other institutes, like we have nursing institute, nursing faculty at Royal Thimphu College, then Apollo Private Nursing College. We have been using their students, in fact, from March.
In the wake of the pandemic, the ministry is also training students of Gesagebo University of Medical Sciences on COVID-19 related diagnostics. They will be deployed as per the need the Technical Advisory Group puts forward. Recently, 103 students were stationed at the Royal Centre for Disease Control. Before the lockdown, the Health Ministry employed 50 doctors who are undergoing specialization abroad. At the same time, 25 lab technicians were temporarily recruited. Sangeet Chizong for BBS News.
Identified shops across Thimphu opened since Thursday, allowing people to come out to buy essentials. The decision to open was made from the way people cooperated in availing themselves of vegetable delivery service and after analyzing the epidemiological situation on the ground. Residents of Thimphu came out excited. Though movement using the cart is restricted, for many this is the first outing since the enforcement of the national lockdown.
For these 11 days, I stayed home. I didn't even come out once. Today, I feel happy. On other days, I have to stay home and it is like staying in quarantine. Today, I carried the cart and came out for shopping. It is refreshing.
I'm very happy. I was waiting and came out as soon as it was time. Otherwise, I was afraid to come out thinking I might contract the virus.
People were talking of a possible lockdown. That is why I bought all essentials before lockdown and didn't have to come out for groceries until now. I am happy to come out, but for these 10 days, I had no reason to come out, so I stayed inside. But the movement card, I think, is a good idea.
Individuals, depending on directives on zoning and time limitations specified on the cards issued, will be able to buy essential items from the identified shops. Apart from grocery shops, medical shops are also open. The implementation of the use of movement cards also came as a relief for shopkeepers.
We opened only from today. Until a few days ago, we were just sending our stocks to other pharmacies and delivering medicines to people by managing despite not having a delivery option. Now, with the Moment Card, people can come directly to our store.
While the initiative is incorporated to make lockdown as endurable as possible, it does not mean that the public is encouraged to come out of the house.
가락이 다면다 가랍시가 된 베니 세미디 다면다 고야 배우데 다면다 야샤 배우데세 디베 투간 디베 농가의 미시 마빠 마지라디 니지기 투게레 배워진디 가데 다도 침나 주미들아 다 세슈니비다 당아체 나바 조닝 날로 튼쇼 세우다 남의 섬에 고야타베 마치 세슈니비라 다 총간나 니틱 라 뇨고민드스 뇨 아치레 람레조 파다추 람레조베 리종기 된레 베데로에 마파 디디키 민두 인드라베루 데셈카디 투 차게디 당아치아니 니지디 또또 희상서버라데 마조 또또루 십세베가라 유세미디 투가자디까지잖아 세슈니비나.
With the country's priority being preventing the spread of coronavirus, the government urges people to use online delivery service, which is still available. Sharab Doji, BBS News. With the country in lockdown, many people have not been able to go to work. This situation has brought in financial insecurities for few, especially for daily wage laborers. For daily wage laborers, the lockdown means that they are now deprived of their only source of income. Some households in the current situation have few or no savings.
While many people have resorted to working from home during this lockdown, there are people whose earnings are mainly based on the actual working days. Even as the delivery of 25,000 vegetable packages came as a relief for many, daily wage laborers are worried.
We bought vegetables and rice earlier, but the stock is depleting. We have less money in the bank. Many might not even have money at all. We only earn 6,500 Newton per month and it's difficult to run the house for a month. They buy on credit.
लेबरहरु 6500 त खाँदैछ पेमेन्ट है इनीहरुको 1 मन्थ सम्म चलाउनु पनि गाह्रो भयो होला कति त बाँकी खाँदैछ इनीहरुले
पानी ल्याउन नपाएर नि रासिनहरु दिन्छ भन्दैछ ठुम्बेबाट पनि त आज आउँछ कि अहिले हामीले
They says they will give us ration, but I don't know when it will come. It's been 3 days. We have little from last time. For now, I have 25 kg of rice, but some of my friends had rations just to eat for this morning.
छ एक बोरा 25 केजी को कोही साथीहरुको सकै छैन आज बिहान खाने मात्रै छ चामल
I couldn't open the meat shop. It's closed. And neither do I have money or anything to eat because I don't have work. And now I have to pay 7,000 Newton as house rent, which I am not able to pay.
We have ordered essential food items from Tumde. They asked us if we have cash or not. They told us that they will deduct the money from our salary and will be delivered to us.
But help is on the way.
These are the people who will fall under the Kidu category. So there'll be a Desup also who will be registering these people's names. And so once that is done, then they can go home, because that list will then go to the Kidu office in office of Gabi Zumbela. So then during the day, they will verify if this person is really in need of Kidu or not. And then if you find that yes, he is in need of Kidu, then in the evening they'll contact him and tell him that yes, you're going to receive these vegetables.
It is without a doubt the current situation is likely to have a large and deep financial impact on the financially weaker section of the society. And today, more than the virus, these people are worried about their survival. Samtin Dolkar, BBS News.
With many people in the rural pockets of the country depending on direct cash transactions, this national lockdown has people stripped of cash. People who do not use mobile or internet banking cannot pay for essential deliveries despite having money in their bank accounts. To help people when in need, the COVID-19 task force in Shemgang is taking banking officials along when reaching essential supplies to people. A banker on the wheels. While essentials are delivered to the doorsteps, people still have to pay for it. That is why the BOB and BDBL officials are taking banking to people's doorsteps in Shemgang.
For the last 4 days, we were not able to go out to withdraw money or buy essentials and had a big problem. But starting today, officials from banks came to our doorstep and eased everything.
Not just cash withdrawals, people can also buy paper vouchers and internet recharges. And this service is extended not just to village people, but even to people in the urban areas in Shemgang.
The main requirement was essentials and mobile vouchers. Now it came to our doorstep. Without a mobile voucher, we cannot do anything. Thank you to the Dzongkhang Task Force.
The service have eased everything for us, and we are very happy that the government has provided prompt services.
About 2,000 people availed the cash delivery service in the first 4 days of lockdown. The Prime Minister, when the lockdown was first announced, said that the government is aware that people will struggle without money during such crisis.
Turu tulingi la nyukangi honglebe jogobachin dera nyukangna jomagoba de jutilgi tolebe toksel benida de nyu tulin benigi kokabe kaara phidi anenga chigi hotline gi tolebe number phidi seshunibe da mise maashogi tulu sagi bomshodi tengachara sathungi de rinam chisobegi nyema nyopso chamasobegi de mingom rerengingi chi nyopso chamnigi de nosam yurura chamnigi kiko mime leshayu ngachari shila 다리뇽소 잡사 다리산 나바사님과 dü미밍오메 레샤 유세미디 등아치기 레짐브라시 세슈니베 아니수기 된뢰 아치라 종카 케지기 데 종다기 우딘 톨루베 디티스에 레림 가라 잠디 데 주틴 앙덩디수 레짐베 지나 세슈니베.
Meanwhile, the Bhutan Development Bank has rolled out cash withdrawal using point-of-sale machines in all districts. People who cannot access digital banking in rural areas can call respective BDBL offices or Dzongkhang hotline numbers to have cash delivered, but only 15,000 yutam will be allowed for withdrawal. BDBL officials will travel with those delivering essential goods to give withdrawn cash to people. With additional information from Pema Samrup in Shemgang, Sharaf Doji, BBS News. Well, that's all we have got in this week's edition of Bhutan This Week. I am Sharaf Doji. Stay home, stay safe, and thank you for watching.